Okay, so boosting a patient up in bed, okay? I've slid down the bed, okay? Instead of grabbing the chuck and just throwing them up the bed, all right? Ask the patient to do it. Get them to do as much as they can. It promotes them moving and getting their strength back, okay? How is the patient gonna do that? Well, ask them to bend their knees, put their feet right in the bed, okay? Ask them to reach for the rails. Okay, now if they can get into this position, they can pull on the rails as they push. Boom, and then they're up. Okay? If they can't reach those rails, okay, they can also dig their elbows in and shimmy and push like so. Okay? Now, one tool that we have is this bed. Okay? One way to help them, okay? Have them bend their knees and then put your hands on their legs so that their legs don't slide. So go ahead as they push. Now I've got something to push against and I can lift and bridge myself up. Okay, and then once I get a little further, I bend my knees again and then hold and push. Okay, for those of you who have not lied in these beds before, these beds are very soft. They're hard to move in. Okay, so you have to give people a chance because they're kind of sunk down in the bed, especially anybody that's overweight and has been lying in bed for more than a few hours. They're going to have a divot in the mattress. It's going to be hard to move out of, so give them a chance. That's also a reason not to try to boost them with the chuck, because they're going to be in a hole in the bed, and you are essentially trying to pick them up out of that hole, which is not going to be good for you. Okay? The other tool we have, all right, Donna, if you could just put the bed in the Trendelenburg spot, is if they still have a hard time, okay, I'm in this position and I'm just kind of stuck, all right, we can angle the bed down about 15 or 20 degrees, good, okay. Now the moment here is really, it's very easy for me to push down, okay. Now I just did that so easily compared to when the bed was flat. Once they're in that position again, we put them back up. We hit the reverse Trendelenburg button, the legs come down, the head comes back up, okay? If you want somebody not to slide, put them in the chair position, okay? So actually hit the key there and just put me in the chair position. What will happen is this angle right here gets created. Okay, actually you can stop it for a minute. You can see now that my knees are slightly above my hips. Okay, keep going. This negative angle will sit the patient in the bed and prevent them from sliding down. Okay, now I'm upright. Good. I can eat. I'm engaged. Okay, I'm not staring at the ceiling anymore, and I'm not going to slide down the bed. Okay, if you just put the head of the bed up, patients are going to slide back down. Okay, so chair position to prevent them from sliding down, especially if they're under a hover mat. Okay, so those are the instructions you use for somebody to boost themselves up in bed. Use the railings, use the bed to your advantage to Trendelenburg, and then when you're all said and done, put them in the chair position.